Hi, it's Hirpal from Safe Care Nursing. I'm excited to work with you as we navigate our way through the Safe Care Nursing framework together. This course consists of 4 modules. Module 1, Critical Thinking and Introduction to the Safe Care Nursing Framework. Module 2, Guided Concept Mapping, Understanding Key Relationship. Module 3, the Priority Setting Tool, Engaging in Proactive Thinking. Module 4, Case Presentation into Action. The Safe Care Nursing Framework has been specifically developed to help nurses working in acute and residential care facilities. Those of us that work as frontline caregivers know that the types of patients we are currently providing care for are typically older and present with many more comorbidities than patients from even 10 years ago. Not only have human systems become more complex, but so have the healthcare settings that we find ourselves in. A changing and more complex system requires nurses to work in situations with many competing demands, where multiple decisions are being made at any given point in time. The Safe Care Nursing Framework was developed to assist nurses working in these complex environments. This framework allows nurses to gain an in-depth understanding of the relationships amongst all of the different categories of patient data. In addition, how to utilize a systematic and thorough thinking process to identify all priorities of care based on the complexity of the patient. As a nurse, I always want things to be easy to use and, of course, efficient because time is of essence in our work lives. The learning objectives for Module 1, Critical Thinking and Introduction to the Safe Care Framework. Number 1, identify the difference between proactive and reactive nursing. 2, discuss the current margin of variability in diverse medical and residential settings. 3, describe the current understanding of critical thinking as a concept. 4, list 4 shared components of critical thinking. Critical thinking. How can we harness the critical thinking process such that nurses are consistently engaged in proactive rather than reactive care? Proactive care involves identifying all risks rather than waiting for that risk to occur and then reacting. For example, most surgical units have identified the risks associated with surgery and intervene in proactive ways to minimize harm. This can be seen in early mobilization of the patient to minimize pneumonia, DVTs, constipation, and UTIs. Reactive care in this situation would involve responding with interventions after these things have occurred. Nursing care becomes safer and more effective and efficient when we function in a proactive manner. Frequent assessments postoperatively to identify either internal or external bleeding are also an example of proactive care. Reactive care would involve responding to hypovolemic or cardiac arrest after the bleeding has already occurred. In some practice areas, the margin of variability in nursing thinking is currently large and often lacks comprehensiveness of priority setting. As the complexity of the patient increases, so do the number of actual and potential priorities of care that need to be thought of. Nurses can function in proactive ways with risks associated with the determinants of health, medications, abnormal lab values, abnormal diagnostics, and with the findings we uncover during a nursing assessment. 3 nurses can assess the same patient, and without speaking to one another, all of these 3 nurses will identify slightly different actual priorities of care and some potential priorities of care. Many reasons such as previous nursing experience, depth of knowledge, fatigue, multiple and competing demands, as well as the thinking model the nurse is using may explain this variability. This is particularly true for diverse practice areas such as medical units where a single patient may have multiple diagnoses and comorbidities, and in residential care where the complexity of the patient increases given greater longevity. Take a moment now and identify the current system you are using in your practice to identify all actual and potential priorities of care. Does your current thinking system consider all of the possible information about your patient? Does this thinking system capture all of the actual priorities in order of what is most life-threatening to least life-threatening? And does this system identify all areas of potential risk for the patient? Every system is designed to deliver the results it produces. The Canadian Institute of Health Information reports that 7.3% of all acute care patients will experience an adverse event which will result in either death, long-term disability, or increased hospitalization. This number is lower than the actual adverse events that occur due to underreporting of such events. Critical thinking is an important aspect of providing safe care. Based on a comprehensive literature review, critical thinking will be defined as having the following 4 characteristics for the purposes of this course. 1. Gathering and seeking information. 2. Questioning and investigating. 3. Analysis, evaluation, and inference. And 4. Problem solving and application of theory. Strong critical thinking, as well as ongoing systems improvement, can decrease the number of adverse events our acute care and our residential patients are experiencing. Errors put millions of patients at risk annually. Nurses are in a key position to not only prevent errors, but to improve patient outcomes. Research demonstrates that there is an association between missed care and increased error and harm. Missed care results from inadequate resources, inadequate time, and decreased critical thinking capacity. Critical thinking can improve patient outcomes through enabling nurses to consider all of the information and perform more evidence-based thinking rather than guessing at the facts. Safety and quality improvement science tells us that a perfectly designed system will be easy to use, effective, and minimize adverse events. A poorly designed system will be difficult to use and prone to adverse events. As a concept in nursing, critical thinking is less than 20 years old. This means that this concept has not had time to mature, such that there is a specific definition and some clear boundaries as to how nursing understands and operationalizes critical thinking. This becomes a problem as we attempt to engage in a process for which multiple definitions exist. Learning activity. Think for a moment, what is your current understanding of critical thinking? What are the indications that critical thinking is happening in other nurses and in yourself? Take a moment to reflect on your response to these 2 questions. Currently, there are 17 different definitions of critical thinking in the nursing literature. Despite the literature, there is a lack of clarity of the concept to date. The multitude of definitions of critical thinking makes this concept difficult to apply to clinical practice. Emphasis in the nursing literature has been on how to define critical thinking and how to apply it to clinical practice. The lack of a clear definition of critical thinking in nursing education and nursing practice is problematic for offering clear direction for nursing thinking and decision-making. Research finds that current models of critical thinking are too theoretical and complex to be applied to clinical practice in a meaningful way. This is also called theoretical rationality. The important step of establishing a practical framework that encourages growth of critical analytical thinking is key. Safe patient care includes a nurse's ability to discriminate relevant from irrelevant data, consider multiple facts, and analyze data from multiple sources to arrive at comprehensive and accurate diagnoses or priorities of care. This is also called diagnostic precision. To date, limited research exists on the diagnostic precision of nurses who arrive at all actual and potential priorities of care. Critical thinking can improve patient outcomes through allowing nurses to perform more evidence-based practice. Critical thinking has the potential to affect patient care safety, efficiency, and effectiveness. Patient safety is increased because we are able to identify potential areas of risk and intervene before these areas become actual problems. Efficiency and effectiveness are increased because we are able to quickly and completely understand significant relationships between all of the patient's significant information and arrive at all areas of priority. We take a comprehensive systems approach, such that everything is always considered in a sequential manner, preventing us from looking at only what is most obvious. A systematic literature review by Chan in 2013 found that the various nursing research studies on critical thinking to date had 4 components in common. The Safe Care framework utilizes each of these 4 components. Number 1. Gathering and seeking information. For example, identifying information about the patient profile related to the admitting diagnoses, comorbidities, determinants of health, medications, laboratory values, and the nursing assessment. Number 2, questioning and investigating. Here we ask ourselves whether there are relationships amongst a single category of data. For example, how are the abnormal nursing findings related or not related to one another? Could the decreased air entry to the patient's lungs be related to the decreasing level of orientation? Once relationships amongst a single category are identified, we then begin to investigate the relationships among the different categories of data. Could the decreased socioeconomic status of the patient explain the lack of nutrition that we are seeing in the physical assessment finding of a decreased body mass index and decreased red blood cell hemoglobin and albumin? Number 3, analysis, evaluation, and inference. In this component of the critical thinking process, we begin to analyze relationships amongst all of the data and evaluate and decide which body systems are experiencing actual priorities for nursing intervention and which systems are at risk for potential problems. Number 4, problem solving and application of theory. In this component, we have identified nursing interventions based on a good rationale for each of the actual and potential priorities and are putting them into action to improve or maintain the health of our patients. Traditionally, nurses have evaluated a patient's diagnoses, comorbidities, medications, physical and psychosocial nursing assessment. Increased complexity requires we also consistently look at determinants of health, abnormal lab values, and abnormal diagnostic tests. With the use of the Safe Care Nursing Framework, we gain advocacy around determinants of health, recognition of abnormal lab values or missing lab values, and a greater appreciation for the entire patient profile. Questioning and investigating. Traditionally, the trend has been for patient information to exist in silos with specific orientation around tasks by nurses. Gains made with the use of the Safe Care Nursing Framework are greater connection of complex information, which leads to earlier identification of any gaps in care. For example, is there something that the healthcare team has overlooked, like a social assessment or a follow-up on a laboratory test? Ongoing learning for the nurse when new information is encountered. Lastly, endorsement of pattern recognition such that future anticipation becomes more readily available. For example, if a nurse consistently notices that a decreased albumin is usually associated with either liver dysfunction or malnutrition, these two areas will be more readily questioned by the nurse the next time this information is encountered. We start the questioning and investigating by beginning with each category of the data in the patient profile. How can the information within a category be related to one another? For example, how do determinants of health influence one another? Is there an opportunity to create a positive change for the individual? For instance, poverty's relationship to access to both suitable housing and food for the individual. The next stage of questioning and investigating moves to asking, how is the information from each of the 5 areas of an individual's profile related to other pieces of information? For instance, the relationship between a diagnosis of chronic renal failure and the abnormal lab values of a decreased GFR with an increased BUN and creatinine, as it relates to a decreased hemoglobin, which would then be treated with EPO administration. The third component of critical thinking, as outlined here, is analysis, evaluation, and inference. The trend in nursing has been to identify the most obvious priorities of care, whether they are actual or potential priorities. Gains made with the use of the Safe Care Nursing Framework are identification of all actual and potential priorities of care in order of most to least life-threatening, such that nothing is missed. If this seems overwhelming right now, in Module 2 we explore the specific questions for consideration to better understand all of the possible relationships amongst the patient's information. The fourth component of critical thinking is problem-solving and application of theory. The trend has been identification of what is most obvious for priorities of care with associated nursing care plan. Gains to be made with the use of a comprehensive thinking approach are identification of what isn't obvious based on risks associated with the patient's diagnosis, medications, lab values, or diagnostics, where potential for unintended harm may lie. With this in mind, nursing care is aimed at preventing potential problems from occurring across all areas of a patient's care. Learning takeaways from Module 1 include 1. Identify the difference between proactive and reactive nursing. 2. Discuss the current margin of variability in diverse medical and residential settings. 3. Describe the current understanding of critical thinking as a concept. 4. List the 4 shared components of critical thinking.